video always gets me a little bit closer than the camera does.
Hi, I'm Mayor Mike Wellner. I'm one with Patty Krug, our county nurse, and we did one of these last Thursday, and things are changing so quickly, almost virtually hour by hour. I want to just give you a couple of updates, and then I'm going to turn it over to Patty because she has some more relevant information for us. Again, we don't want to panic anyone, but we need to be prepared, and I don't think I can emphasize that enough. That we need both. We don't want to panic, but we have to be prepared. A couple of things. We are now meeting with our department heads every other day to keep them up to speed on what's going on. We're having another meeting at 1 o'clock today with them to keep everyone on the same page. Also, we've had something about voting. I want to emphasize again that you may vote online, or you can vote down at City Hall Monday through Friday from 8 to 4:30, and you can do that until April 3rd, that Friday, the week before the election. So just to clear some of that up, again, Monday through Friday, 8 to 4:30 until ending on April 3rd. The other item is we on Tuesday had a proclamation of local state emergency that our council passed, and I'm just trying to look at the reason for that proclamation is to hopefully be more efficient and to be being able quicker to get things done and provide services. To authorize emergency purchases of goods and materials, to authorize emergency purchase of services, authorize intergovernmental agreements for necessary services to virtually our mutual aids, authorize emergency cost of labor force, and to allow the city to categorize emergency expenses for possible future federal or state reimbursement. We don't know where, it's all in fluctuation, that we're hoping at some point that we could be reimbursed for from the state or from the federal government. And so we passed that state of emergency. With that, I'm going to turn it over to Patty Krug, who's done a tremendous job for us and keeping us up to date. So Patty?
Okay. Thank you, Mayor. I am here to talk with you as a local health officer for Taylor County. And when I'm talking about county, I'm talking about community, I'm talking about all of us are in this together. So currently, as of 12:10 p.m., we have no positive cases in Taylor County of COVID-19. Again, we have to monitor per the CDC guidelines for those countries or states that are considered level 3 or level 2. This will continually change on a day-to-day basis, hour-to-hour basis. If you travel to a country or a state that has sustained community transmission, we are asking you to remain home, isolate, and quarantine for the 14 days. If you develop symptoms, we ask you to call ahead to your medical provider. Let them know where you have traveled and what symptoms you are having, and they will direct you what your next steps should be. If you travel from a country or a state that is a level 2, has shown no community transmission whatsoever, right now the recommendations are to monitor your health, social distance, but you can go to work. Your employer, your company, your governmental unit may have their own internal policies, and so that will supersede whatever they put into place. Now remember, when we're talking about symptoms, we're talking about a cough, shortness of breath, and we're talking about an elevated fever. If you are symptomatic, again, non-emergency, we want you to call the healthcare provider prior to going in to seek medical care. On our website and on our Facebook page, and you can go directly to those facilities, Aspirus and Marshfield Clinic, have their numbers for you to call if you have any questions about COVID-19, and that's what we recommend for you. Again, prevention, cover your cough, wash your hands, social distance. That has remained the same. That is no different than if we're undergoing influenza. Those are the same rules. That's what we want you to follow. What happens if you become tested? We will get those results. We will ask you, we will call you, we will give you what the recommendations are at that time that need to be followed if you are tested. If you are an employer and you have somebody in your company who says, I have been tested, they are giving you that information. If it would be a positive case in that event, we will contact you as per the state and federal recommendations for contact tracing. So we will be in contact with you. If you have an employee who says, I have been tested, there's nothing that you can do at this time because there are people who are being tested that are also negative. If they are positive, the health department will be in contact with you if your business needs to take any further action. Again, Governor Evers' orders, those are in place. You can find those on the Taylor County website, and you can also find them on our Facebook page. This is a difficult time for all of us, and we understand that. We understand business practices have changed. We understand your lives have changed. You as an employer, everything has changed. But again, we need to understand what we're trying to do is protect the health of our community, all of Taylor County. There are some difficult decisions that will be made. There are some opportunities where you may not go to work if someone in your family has been tested. Those are the current guidelines. We understand it may be difficult for you as a family member, a personal member, or as an employer. But again, let's think about the people you potentially expose. We do not know. You don't know who your coworkers are that maybe you're working with that have family members that are undergoing cancer treatment. We don't know if they have children that are at risk. Again, our main focus is to protect the health of our community and our citizens. We also, as a health department, we would like to thank all of those community partners. Please remember to show your appreciation to your healthcare providers, your EMS staff, your first responders. We also want to thank the businesses who continue to put in place best practices and working with us to understand we are just here to protect the health of the community. Again, we are all working diligently together. We ask you to have patience if you call the health department. Leave us a message. We will get back to you. Please do not call dispatch to ask us to be paged or to have us answer our phones. We will get back to you. We're working on this as hard as we can. So please have patience with us, along with all of your community providers, your truckers, your businesses. They're all working together on this. And we have to remember, together as a community, we're all here to protect the health of the public, and we're all in here together. And as a community, we make ourselves stronger, and that's what we want to be done. So again, I appreciate everybody's efforts and working with us. I appreciate your efforts, and let's continue to protect the health of the community. Thank you.
Thank you, Patty. And again, just to reemphasize that it's not just a city, it's not just a county, it is a community effort, and I think everybody in this together, that together we will be stronger. I appreciate your patience, and I appreciate your cooperation, and it's a very tough time for everyone, but we will get through this. And thank you.